Hi, my name is Dr. Wellens and I'm here to talk to you about tarsal tunnel. So what is tarsal tunnel? It's an inflammation of a nerve in the tarsal tunnel canal, which is in the medial aspect of the ankle, and it's caused by different factors, and a lot of the times we don't really even know why people have tarsal tunnel. It is a condition that is very similar to carpal tunnel, but carpal tunnel is definitely much better diagnosed and much better treated because it is much more common. And we do see more carpal tunnel and tarsal tunnel in diabetics due to the neuropathy factors that I'm not even going to discuss today, just because it is a 1-hour topic discussion by itself. But in a nutshell, it's basically a pain on the medial aspect of the ankle that is radiating to the bottom of the foot. And it's, again, a lot of the times it's idiopathic. Sometimes we don't even know what causes it. We do see it more common in our diabetics. And it's called the diagnosis of exclusion. What does that mean? It means that a lot of traditional tests such as MRIs, CAT scans, even nerve conduction studies and EMGs will be negative, meaning that you go to the doctor, you have severe pain, and the doctor runs a bunch of blood tests, a bunch of different diagnostic tests. And the frustrating part about tarsal tunnel is that a lot of those test results are negative, meaning that basically the radiologist reads it as a normal MRI or normal CAT scan. The nerve conduction study testing is still considered standard of care, but I can tell you is medical literature reports as high as a 50% false negative results on the tarsal tunnel in nerve conduction studies. And a lot of the times, if the nerve conduction study is positive on the tarsal tunnel, it means that there is already irreversible damage that is done to the nerve. So what are the treatment options for tarsal tunnel? Well, number one is accurate diagnosis, right? As I mentioned, it's a lot of the times a diagnosis of exclusion. We want to be sure that there is no peripheral neuropathy, no lower back issues, because they can mimic tarsal tunnel. But there are not a lot of non-surgical options for tarsal tunnel. I mean, of course, we always try cortisone injections, anti-inflammatory medications, orthotics to see if correcting the pronation will help it. But unfortunately, a lot of the times, because of how much scar tissue is around the nerve, it is a surgical procedure. The good news is that there are quite a lot of advances on nerve surgery in tarsal tunnel. And I can tell you I've done hundreds of tarsal tunnel surgeries, and there are definitely tricks up my sleeve that I use that I didn't use 20 years ago that really help us not to form more scar tissue and definitely improve our surgical results. But the key moments are you need to be sure you're accurately diagnosed. You want to be sure you don't jump prematurely into surgery that you don't need. And I can tell you is that it's probably one of those diagnoses that I see a lot of second opinions on. In fact, I just recently saw a couple of patients who were misdiagnosed and had Morton's neuroma. But when we really did do the true clinical examination as well as diagnostic blocks, which are very helpful, we found out that they did not have Morton's neuroma, they did not have metatarsalgia or capsulitis, that it was a true tarsal tunnel situation. And basically, I think one of my patients, I think it was his 5th or 6th opinion, because he was very educated. It didn't make any sense to him. So he was basically misdiagnosed, and luckily we diagnosed him and treated him, and he did very well.